Hello everybody and welcome to this tutorial. I hope you are doing very well. So today we were talking about malaria, complicated malaria and how to diagnose. What happened with the malaria when you are in your consulting room, you receive this patient with these signs and symptoms, and then you perform the lab test and the lab test is positive, you prescribe your drugs and everything is going well in the majority of the patients, but there are a few patients which go to be complicated. So if you are not able to diagnose this complicated malaria earlier, the patient can die. So today we are giving the tools to make you diagnose and save the patient life. So we were talking about abdominal ultrasound, B scan or eyes ultrasound, CT scan, and MRI. All these tools you can find in any hospital. Okay, so let's go. Okay, let's talk about malaria, which is a very known disease here in West Africa. The most common finding ultrasound is the pathosplenomegaly, and in case of B scan or eye scan, is there have done a lot of research about of the measurement of the optic nerve shift, which is very precise. There are a lot of research, and it can give you a good reference about the diagnosis and the complication of the malaria. In this case, the cerebral malaria. So when you have present the cerebral malaria, we are going to see in this B scan where you can request from any part. But it's very important to know. So when you suspect cerebral malaria, you have to request for B scan, and the ultrasonographer or radiographer should be able to perform the kind of this scan and give you the exact dimension of the nerve shift. Is very important for you, which the diameter is about 2 to 3 millimeters. Okay, above of that, so you consider there is some serious damage in the nervous system. Second to malaria, that's very important for you. For malaria, the majority of the cases is blood test, history of the patient, physical examination. Just ultrasound is complementary, but like I say, in this case, the B scan is very important. But also you can request chest X-ray. In the majority of the chest X-ray, you want to see this marking lumps increase. You also, in the majority of the cases, you want to see this bilateral acupulmonary bilateral pulmonary edema. Bilateral pulmonary edema with this radiological signs of bat going or butterfly sign, which is very is specific for this kind of disease, pulmonary edema. So it's the more common side you're going to see in the chest X-ray. Also when you see a CT scan, it's also most of the same. Then for general, they can produce a cardiac failure, and then they can produce this acute pulmonary edema. It's more important to know. We are talking about malaria on the chest. Also, we can combine this cardiac failure also with pleural effusion. Okay, so you have to be in mind when you request for chest X-ray, we increase the marking of the lumps. The second is this acute pulmonary edema, and the third is maybe pleural effusion. Now, in case of cerebral malaria, you have to request for a CT scan as well. That's combined with this ultrasound. Mean you have done the ultrasound, you are suspecting cerebral malaria, you are on the treatment, and then you want to know more about the patient. You have the possibility to request for CT scan. So you are request CT scan, and maybe you go to find cerebral edema, thalamic hypotension, and cerebral white matter hypotension from infant, and sometimes it can be normal, and the patient can have cerebral malaria. So also you have to rule out that. So negative CT scan that don't mean the patient doesn't have cerebral malaria. Okay, but or we have to request for the BE scan. I think it's more predictable, the diameter of the nerve shaft than the CT scan itself. Okay. Also, the MRI is very good in that in this case. It's very important. But there are all facilities that we can provide MRI. Okay. So I think it's more based in your experience, the history of the patient. You always have to think in malaria. I mean, the patient is complicated, always think in cerebral malaria. Okay, always think in cerebral malaria. So I think it's a more clinical situation. So put the patient on the treatment and then we request for the complementary studies. Okay.